Okay, so we got Jill here, our patient. My name's Dan, and I'm going to teach David right here how to do a goniometric assessment of Jill's left elbow. Okay, so I'm going to go ahead and demonstrate that to you, David. First thing you want to do is you want to have your patient in a supine position on their back. You also want to put a towel underneath their arm, like so that their arm can get as much extension as it can in this position right here, okay? The next thing that you're concerned about are the anatomical landmarks, okay, for this measurement. And for elbow flexion, you're concerned with the lateral epicondyle of the humerus. That's where the axis of rotation is going to be for your goniometer. The stationary arm is going to be at Jill's lateral acromion, and she's wearing a shirt right now, which probably isn't the best thing to be wearing when you're doing this measurement, but you know, in the clinic you can see a variety of different apparel, yes. So yeah, we're going to just palpate the lateral acromion. It's going to be right there, and then the movement arm of the goniometer is to be positioned at Jill's radial styloid process, okay? And we're going to do an active motion test, active test of Jill's range of motion. Okay, so I'm going to have Jill first perform this, and I'm going to palpate an end feel. Okay, so there's our end feel, and it's soft. Okay, so now I'm going to position the goniometer at the landmarks that I just discussed. Okay, making sure that they're in line with that. And I'm looking at Jill's initial position right now, and she's right at 0 degrees, which is great. Okay, so I'm going to keep that in mind, 0 degrees. Now I'm going to ask Jill to actively go through this motion. So go ahead and do that, Jill. Bend your elbow. Okay, making sure I'm at these spots here. Checking, and I've got Jill at about 148 degrees of elbow flexion. Okay, and 150 degrees is normal, so she's very close to that, okay? You're going to record that, and then you're going to go ahead and give a second measurement just to test your accuracy, okay? To make sure. So what I'm going to have you do is just go through those, okay? And I'm going to be cueing you, looking for anything that you're doing well or any mistakes that you might be making, okay?
Okay. So, Jill, I will be performing this, and so lateral epicondyle,
Great.
acromion, and styloid process.
Great, Dave.
Okay. And go ahead and flex for me.
Okay. All right, David. So one thing I can see that you're not doing right now is what everything else sounds great. It's great that you're instructing her on what you're doing. So if you can just take the stationary arm, and if you can put it in line with her humerus going up to her acromion process, okay?
Okay.
So just reverse those. Perfect. And then try to make your measurements a little bit more accurate, okay?
Okay.
So yeah, just palpate that acromion and palpate her radial styloid process.
Okay.
Perfect. Okay. Great. You might also want to assess for an end feel also.
Okay.
Go ahead and continue on with your measurement. Doing great.
Okay. And there we go. And I get 138.
Okay. 138. Okay. All right. Now I'm not going to tell you the second one, and I want you to just see how close you can get. So I want you to go ahead and bring her arm back down, okay, and make sure she's at. Make sure you test her neutral position of her arm.
Okay.
Okay. So using the same landmarks, great. I like how you're palpating. You're doing a great job. Okay.
And now 0.
Okay.
And now I want you to go ahead and flex for me.
want you to just go ahead and give me the goniometer when you're comfortable with that measurement, okay? Great. Just gonna record that. All right, Dave, so your first one, you got 138 degrees. That measurement, you got 142 degrees, okay? So you're about 4 degrees difference, okay?
Okay.
So that's where you were at with that. That's pretty good. Some things that you can do as a PT student for you to help improve on your measurements of this. I want you to maybe one night per week work on a goniometer assessment of any limb in the body, okay? So since we did elbow flexion, you might want to just check that one time a week, okay? Just to keep up on that. Also, a good thing to do is to practice the whole skill of this, not just parts of it. So just do exactly like we did where you're going through the whole process of this, okay? And you can help doing that. You can prepare for that by mentally preparing, thinking about what you're going to do beforehand. And it also helps to do this on a variety of different patient sizes, okay? Because a lot of people, they might not have as much range of motion as Jill has, or they might, be very muscular or have a little bit more of fat tissue on them. So it might make this a little bit harder of a process, okay? So do you have any questions for me?
I think you explained it very well.
Great, I appreciate that, okay? And that's that assessment.